You have the floor.
Thank you for your introduction. And indeed, those last two projects are what I'm also going to talk about, the challenges in dementia that I've organized. So a year ago, I wrote a survey, a review paper evaluating image analysis and machine learning competitions in dementia. And this talk will be mostly based on that survey paper. And for today, especially, I will focus on the data sets. So first, a bit on the background. All the challenges are about the field of dementia research. Worldwide, over 50 million people are living with dementia, and Alzheimer's disease is the most common underlying disease. But there are multiple underlying diseases, and that is also one of the challenges, of the clinical challenges that are in this field. One of the challenges in which image analysis and machine learning techniques can play a role. So one of the challenges is diagnosis. Diagnosis in dementia is difficult. There are multiple underlying diseases. Disease processes are complex, involving many factors, and therefore it may take a long time to a couple of years before people get their diagnosis. And yeah, so clinical criteria here are not fully correct. So there's room for improvements that we can get out of imaging and multimodal information. So clinical status, I named it here clinical status as a bit of a wider term, because we may also refer to estimating the cognitive performance at the time of diagnosis, of the time of visiting a hospital with their complaints. Clinical status estimation is one of the challenges. There's also a challenge a bit earlier, because the real interest for diagnosis is to make the diagnosis as early as possible to support people in getting the right care, the right treatment, but also in having people identified, including trials for getting new medications. And the purpose here of screening is also to find even earlier biomarkers in healthy people that can be used, for example, in clinical trials. Because at the moment, screening a healthy population in dementia, there's no points to it, in contrary to, for example, like breast cancer or lung cancer, because there's no treatment that would help everybody. But still, screening is a challenge. Another challenge is prediction. So after people get the diagnosis or after they present with memory problems, it will be interesting to predict who of those patients will, for example, patients with mild cognitive impairment, which is an early stage form of dementia, which one will become more symptomatic and evolve an actual dementia. So that's one of the prediction questions that interest. And lastly, we are interested in monitoring. So how will the disease develop, and what can the patient expect next? Or how can we test, for example, how effective the drug is? So these are the four challenges that can be, for which imaging can help. And if we then talk about imaging, there's different types of biomarkers. So in clinical practice, it is a radiologist scoring mostly the brain for atrophy, for shrinking of the brain in specific locations like the medial temporal lobe of the brain, and also assessing the brain for vascular infarcts, vascular microbleeds, for example. But regarding atrophy, where the field is going towards a more quantitative approach. So many AI companies are also jumping onto this. So estimating brain volumes quantitatively using segmentation techniques, voxel-wise information, so also the shape of the brain in specific locations is of interest. And in addition to the structural information, advanced MRI is used to assess the perfusion in the brain, for example, to assess white matter microstructure using diffusion imaging and a functional MRI. So these are the main imaging markers that are used in dementia. And of course, I don't mention PET here, but PET is also amyloid PET, FTD functional PET is also a main neuroimaging biomarker for Alzheimer's disease. And we've seen in the research field that training machine learning methods, mostly based on imaging data, but often also in addition in multimodal data, So using also cognitive testing and lab testing helps for solving these challenges. So especially for diagnosis, having real healthy patients and dementia patients in research data sets, methods can do this very well. And this field is quite big, so many publications, and this took off mostly from 2008 when more and more data sets became available. But the question came, so there's many papers, which model is the best? And that's, of course, here grand challenges come in. So how good are the current models? What would be the best strategy to do machine learning for these dementia challenges, for these dementia questions? So the concept of challenges has already been explained, of course, but benchmarking is here of interest. And of course, the competition always helps for motivating people in general and also researchers. So that's when in 2013, there were really not so much challenges yet. I think challenges were coming in this field in medical image analysis in general, but not so much yet in dementia. Well, we already saw then a lot of machine learning methods performing well, at least according to their papers, but far from being used in clinical practice. So hard to compare as well, because data sets and evaluation methods varied. And what we also missed is that hardly any of the methods perform testing on like a separate data set. So how the methods would generalize to a new clinical population was not so much assessed. And we also targeted here. So as I said, most methods did Alzheimer's disease versus controls, while we felt like a category, or according to comparing to the clinical diagnosis, is early stage patients were left out. So that's what we included in a multi-class classification problem. And then indeed, we faced the same challenge as mentioned by Amber, because we wanted to share data with outcomes, or at least for a little training set we wanted to. And then, of course, the larger testing set was kept private, so the diagnostic labels were kept private. But still, it was hard. We spent quite some time finding, indeed, clinicians willing to collaborate and data they were allowed to share given the consent and that they could share. So, but we did. So we found a multi-center three hospital data set of in total 380-ish scans that we could share. And there we set up this challenge of this 3-class classification problem based on MRI images to classify Alzheimer's patients, MCIs, and controls. And we had 15 teams participating with a total of 29 methods. And in the little graph here, you see the performance with accuracy, so correct classification rates on the y-axis. And you see that the top methods performed from Copenhagen, actually, got a performance of 63%. And so this is a 3-class classification problem, so it is a good performance, but not good enough yet for a clinical application. So this was the first challenge in this field, and then it was followed by I co-organized a couple of years later a prediction challenge, for which we used multimodal data of a public data set. And as the goal here was prediction, we allowed participants to submit their predictions, and then the evaluation data was acquired actually after the submission date. So we could still use public data in a way to have a challenge without cheating being possible. And we asked participants to predict also the cognitive label 1 year in the future, 5 years in the future, a cognitive outcome, and an MRI measurement, the size of the ventricles in the brain. And here, as a brief overview of the results, we could predict, or the methods could predict diagnosis and MRI measurements quite well for the cognitive score, no winner was declared because all methods had suboptimal performance. So that were my two challenges in dementia. And this got me wondering, like a bit more than a year ago, are these the only ones? What is being doing? Is this helping? Is the field progressing? So that was the time for a survey. So we set up the survey based on other efforts in the field. So this paper by Lena Meyer-Hein, defining criteria of what makes a good challenge, what criteria should be fulfilled. So this one and this other overview paper by Adrienne Mendrik and Steven Aljard, they also set up a framework for challenge development, splitting insight challenges, so getting insight into a scientific problem, from deployment challenges, so developing methods that could actually be used. And based on these two papers, two frameworks, we defined how to evaluate those challenges. And then we found 7 challenges. So I'll talk now about the inclusion criteria for papers. So we looked for competitions, challenges being organized in the field of preclinical or clinical dementia. They should have been organized as a competition, at least have neuroimaging data as an input, and have their task related to those 4 categories that I defined before. So screening, clinical status, prediction, and monitoring. So we identified almost 500 records, screened them, and ended up with 7 studies being included in this survey. So these are the 7 studies listed according to the 4 tasks that I defined. And we had 3 challenges doing some type of screening tasks, so targeting a healthy population and seeing if we could identify early biomarkers. So the DREAM challenge actually had 3 different tasks over the 3 categories, and their screening task was screening for from genetics data and clinical data, could we detect amyloid pathology in a healthy population. The second of the other 2 tasks both did a brain age estimation. So in a healthy population, again, could we estimate how accurately can we predict age from an MRI scan? Then there were 3 diagnostic challenges. So CAP dementia, that's my own, I already explained that. Then there was another task of the DREAM challenge, which estimated MMSE, which is a simple cognitive score from the MRI scan. And the MCI neuroimaging challenge I put here in 2 colors, because this challenge combined a diagnostic and a prediction objective, basically in one classification objective. So it was a 4-class classification of Alzheimer's patients, MCI, so these are the mild cognitive impairment patients, which may develop into an Alzheimer's disease or not, but they already have some complaints, but no dementia yet, and the control. So classification of those 4 categories. And then the other prediction tasks were prediction of this cognitive score from genetics and clinical data, so prediction of the future, and the tadpole challenge that I already explained. And then the myriad, so the monitoring challenge, they predicted atrophy. So this was the most image direct, based on images, how accurately different methods estimated shrinking or growing of the brain, but that's not the case here. Brain shrinking, atrophy measurements, and how accurate it is. So looking at the data, now I should move this so I can see my notes. You can see, so I listed here the data sets that were used by the challenges. You can see they differ quite a lot in size. I must also say that the time span of these challenges was almost 10 years. So that may also had an influence on that. Most of them used multi-center data, so data from single centers, except for myriad, so the atrophy challenge, and the machine learning challenge, which used single center data from OASIS. Most of them used only MRI data, but DREAM and TADPOL, so the prediction challenge and the challenge with the multiple tasks, they used multimodal data. And for MRI data, there were some using the images directly, some pre-computed, and some a combination. And I think for, so this also refers a bit back to what Amber said, because pre-computed data makes it easier for more participants to participate, because basically all machine learning, you need only basic knowledge about images to work with those pre-computed images, while state-of-the-art methods on imaging may not be included if you only allow to use pre-computed features. Then for the testing data, we also saw variation in size, and most of the challenges used like same population data for training and for testing, except for the DREAM challenge, which explicitly used different population data sets. And in cat dementia, as you can see, we used a very small data set and a bit of larger test sets. And that is also to test this different population effect, because you will see later that in this column of extra training data, we allowed for external training data. Yeah, so mostly test sets were defined in a natural way based on visit date, using a separate cohort or using a random split. And the variance in the tests, fixed test set was usually used. So not like you do in your research paper where you do like cross-validation, for example, none of those challenges did that. So randomizing variation, assessing the effect of this variation was not done in these challenges. And to avoid cheating, so mostly labels, prediction labels were blinded, so not given to the patients. And that was not possible for the competitions, these ones using OPNI. So they used some other tricks, as using new follow-up data that was not seen before, or including dummy data. So yeah, to basically put some noise on the data by using dummy data. Then 4 of the challenges allowed extra training data. So you can see them here. And then also some challenges gave like intermediate results to be shown during the participation phase. And there were different strategies using train test subsets to do that. And as you can see, multiple challenges use the same data sets, and that is the OPNI data set. So OPNI, I don't know if you have all heard of it, but it's a very, so it's the Alzheimer's Disease Neuroimaging Initiative. And it's very widely used. I think it's the curve I showed before is mostly driven by OPNI becoming available. So I think it has been, this public data in this field becoming available has been a huge impulse for the field to grow. But I think, but it's also something to be careful about, because we may, with some of the challenges, it may seem like we solved the diagnosis problem, but we may have solved the diagnosis problem within OPNI and not for the general patients. So to demonstrate that a bit, I show here the inclusion criteria. So it's a very multi-site study, but people are of good general health, but which could not be set for all dementia patients in general. And also all people showing infractions on MRI or lacunes on MRI scan are included. And it's known from like population-based studies that these occur a lot together, like the vascular infarctions on the brain and dementia. So we exclude all those people here in OPNI, which is also demonstrated by the circle plot. So this is an important thing to realize. So the circle plot compares a subset of the OPNI to a dementia study. where we can see that the white matter hyperintensity, so one type of vascular lesion, has completely different distribution in these populations. And as I already said, this APNI data is being used a lot. So based on review papers, it differs between 60 and 90% of studies that use this. And it is large, and it's also very easy to access. So which is a very good thing. But all the other data sets that you can see on this slide some may beat APNI in size, but their ease of use is much less. So back to the challenges. So what we can see so the research questions that were evaluated in those challenges were quite different. So also there were differences in data and how it was used. And I won't go into this talk into metrics and the methodology for ranking that was used, but there were also differences there. But was done in a quite similar way was how to avoid cheating, how to estimate uncertainty of the methods, and how the challenges did statistical testing to assess differences between different methods. So to the main findings, winning algorithms of the challenges, I think we could say that they generally did pre-processing of the data with care. So paid a lot of attention to data cleaning and pre-processing, and used a wide range of input features based on the images. Seems like more training data or pre-training the methods helped. But regarding modeling methodology, machine learning methodology, no single method stood out. But we should also emphasize here that there was a large time span over challenges, and many of those challenges did not include so many deep learning methods, for example. So we cannot make a full conclusion about the field, but for those challenges, no single modeling methodology stood out. Most challenges looked at qualitative trends leading to high performance. So what data type did help, what features did help, what models did help. But these are just trends. So the former three conclusions are also based on trends, because the challenge didn't allow for any statistical analysis of this. Then related to clinical impact, if we use the terminology of this framework paper, they were all insights challenges. So not producing ready-to-use methods, but providing insight in how a research problem should be addressed, and pushing the state of the art towards answering the clinical questions. So challenges could be and are, I think, a very good benchmarking case also to assess how are these research methods applicable to real-world clinical data. But this is still being done. These challenges do this in a very limited way. And I think that's related to, of course, how easy it is to share data. But I think this is key to clinical impact. And there is opportunity to do this. And here we see challenges resort a lot to public data, which is understandable. But I think that limits the real world applicability of the methods being compared. And also of these challenges, methods are being compared. The algorithms are mostly not available to the community. So for future challenges in this field, I think it would be key to address clinical questions using a larger variety of data. So beyond the research data that is already public, and beyond only Alzheimer's disease. An aspect that is not taken into account, which is key here, is how would clinicians use those methods? So how, for example, is their understandability, how would they interpret the methods? So I think a challenge would be to implement that part of the evaluation in a challenge. Assess the performance related factors, so to be able to make better conclusions on what works and what not works. And for sharing data, it was already mentioned, maybe a federated approach, bringing algorithms to the data, may be a way to go. And with that, I would like to thank you for your attention. And for the interested ones, this is a link to the paper that I based most of this talk on. So thank you for your attention.